I think if there is one message today, is the population can help us in that.
Emergency rooms in Quebec are overcrowded. At 1 p.m. Tuesday, ERs across the province were at an average of almost 140% capacity, with some at more than 200% capacity. Here at the Montreal General, 181% capacity for their emergency room.
What we're seeing is patients are suffering in hospitals throughout the island of Montreal and Quebec. And people who are struggling to breathe, people who might be having heart conditions, are not getting the prioritized care that they deserve. That's what we're seeing.
2 patients died waiting for care in the overcrowded emergency room at Anna-Laberge Hospital in Châteauguay on Montreal's South Shore in late November. On Tuesday, Quebec Health Minister Christian Dubé addressed the current overcrowding in ERs, saying much of it can be attributed to people going to ERs who are not in an emergency situation. He says the Quebec government has several measures to address overcrowding in ERs. One of them has been to purchase beds in other facilities to free up hospital beds for ER patients.
We bought about 200 and we're in the process of adding another 300. So 500 places makes a big difference, especially in the Montreal area, what I call the greater Montreal area.
Paul Brunet, chair of the Quebec Council for the Protection of Patients, describes the current situation as a catastrophe, adding that wait times are the highest he's seen in 25 years. He suggests that one of the solutions to the problem could be a return to more family medicine and home visits as a way to reduce the amount of people going to ERs.
Without visiting patients, kids, elders at home, when we used to do that for many, many years, well, then we stopped doing that and waited for them when they were very sick to get to the emergency ward.
As bad as overcrowding in ERs is now, it could get worse. The health ministry is predicting that cases of COVID and flu will significantly rise in the coming weeks.
We have a lot of vulnerable people that come because of influenza or because of COVID, and they should have been vaccinated. And I think that the situation over the next few weeks will deteriorate. Let's be clear about that.
It's quite extreme. Cases of RSV, COVID, flu are jamming up the emergencies throughout the island of Montreal and also Quebec.
In Montreal, Gareth Madoc-Jones, City News.